Good day, students. My name is Svetlana Babayeva. I am Associated Professor of Department of Pharmacology, and the title of our lecture is Pharmacology of Antimicrobial Drugs. It's antiseptics and disinfectants. Antimicrobial drugs widely used in the treatment of infection diseases. Medicines with an antimicrobial activity are divided into groups. It's non-selective drugs, antiseptics and disinfectants. These drugs with broad spectrum of activity. These drugs are toxic for microorganisms and for host, and therefore used only local. Selective antimicrobial drugs, like antibiotics, synthetic antibacterial drugs, antiprotozoal, antiviral, and antifungal agents. These drugs with more narrow spectrum of activity in compare with non-selective acting drugs. They are toxic for microorganisms and non-toxic for host. Therefore, in medicine used their resorptive systemic action. The first title is Antiseptics and Disinfectants. Antiseptics, it's drugs which are used to destroy or inhibit the pathogenic bacteria on animate living surface. This is drugs used for processing of skin, eyes, mucous membranes, different cavities. Disinfectants, it's chemical substances that are destroy or inhibit the growth of pathogenic bacteria on inanimate, non-living surfaces. For example, these drugs used for processing of surgical instruments, for cleaning of different equipments. For example, formaldehyde, phenol, alcohol, and other. Depending on dose, these drugs produce bacteriostatic effect in low dose and bactericidal effect on high dose. What the important requirements for antiseptics and disinfectants? An ideal antiseptic and disinfectant must have a broad spectrum of action. Rapid onset of action, should have a small latent period, should have a high activity, must be chemically resistant and high availability and low cost. How do act antiseptics and disinfectants? The first mechanism is oxidation of bacterial protoplasma, so act potassium permanganate or halogens, denaturation of bacterial cells or microbial enzymes, so act phenols, chlorine-containing drugs, aldehydes, and heavy metals, and detergent-like action, increasing permeability of bacterial membrane, so act different salts. Antiseptics and disinfectants and their classification according to chemical structure. For example, detergents, so cationic soaps. It is Cerigel, Rockal, Degmicide. These drugs with broad spectrum of action. These drugs has antibacterial activity, antifungal activity, and generally used like antiseptics for washing of hands, for example, before operation, or for cleaning of different equipments. Nitrofuran derivatives, furacilin, furaplast, lifuzole. Furacilin in medicine used in solution form. It is yellow-colored powder. Furacilin is drug with broad spectrum of activity. It's effective against gram-positive, gram-negative bacteria and has antiprotozoal activity. Used for cleaning of wounds, for processing of different cavities. Widely using nowadays, it is chlorine-containing drugs, chlorhexidine. Chlorhexidine is biguanide derivatives. broad-spectrum acting drug, antibacterial, antifungal drug with high antiseptic activity. Phenol and related compounds. Phenol, it is antiseptic and it's disinfectant with high antibacterial activity. These drugs use like disinfectant because this drug is very toxic. Very rarely used like antiseptic because this substance is lipophilic substance and easy penetrate through different barriers and accumulate in liver. It is hepatotoxic compound, but resorcin, it is phenol's derivative, widely used in medicine, for example, in dermatological practice, and its effect, pharmacological effect, is dose-depending. In low dose, it's produce keratoplastic effect. In high dose, keratolytic effect. The next group of drugs is dyes, for example, etacridin lactate, brilliant green, methylene blue. These drugs are drugs with broad spectrum of activity. For example, methylene blue. Its pharmacological effect depend on routes of administration. Can be used local like antiseptic. We can administrate peroral in case of infection of urinary tract, and this drug can be used intravenous in case of intoxication with hydrocyanic acid poisoning. It is antidote. How to act this drug like antidote? Methylene blue interact with cyanomethhemoglobin and forms non-toxic compound. Brilliant green, its drug used in solution form. It may be aqueous solution or alcohol solution, and generally used for treatment of pyodermia because it has dried properties. And etacridin lactate, widely using drug in surgery practice, gynecology, urology, ophthalmology, and dermatology practice. These drugs, drug used for washing of wounds, different cavities, for example, pleural, peritoneal, or bladder and uterus. Halogen-containing drugs. It is chlorine-containing drugs and iodine-containing drugs. These drugs with high antibacterial activity. Chloramine B, chlorine-containing drug, used like antiseptic for cleaning of hands, for example, or it can be used like disinfectant. This drug has deodorizing effect. Pantotenacid or pantocid, this tablet used for water disinfection. Iodine-containing drugs, it is iodine alcohol solution, antiseptic, which will apply it around the wound, and this drug has irritating properties. Lugol solution used in law practice. It's the drug contain iodine, potassium iodine, water, and glycerin. More prolonged and mild-acting drugs is iodophor and iodinol. The oxidizing agents, it's hydrogen peroxide, potassium permanganate, and hydroperite. Hydrogen peroxide, under influencing of catalase, which present in wounds, converts hydrogen peroxide into molecular oxygen, which forms the bubbles, and these bubbles produce mechanical cleaning of wound. Hydrogen peroxide has low antibacterial activity. Potassium permanganate on the surface of skin, mucous membranes of wounds, liberate the atomic oxygen which has high antimicrobial activity. In some cases, this drug is administered peroral in case of intoxication, for example, with morphine. The heavy metals widely using drugs, it is mercury-containing drugs, silver, zinc, bismuth. For example, zinc sulfate or silver nitrate used in ophthalmological practice. It is eye drops used for treatment of conjunctivitis, or silver nitrate for treatment of blenaria. The mechanism of action of these drugs associated with interaction with sulfhydryl group containing microbial enzymes. And by this way, heavy metal containing drugs, they are kill the microorganisms. Silver nitrate, its solution, and its pharmacological effect depend in dose. In low dose, silver nitrate cause formation of mild albuminates, but in high dose, it's produce so-called cauterizing effect. For example, cholargol is colloidal silver used in the form of nasal drops, but protargol is silver proteinate. This drug generally used for processing of different cavities. Mercury-containing drugs, mercury bichloride, and, for example, lead plaster, these drugs were rarely used today in medicine because mercury is substance with high absorptive properties, and therefore it can accumulate in the body and at first in kidneys. In case of intoxication with heavy metals and at first with mercury-containing compounds, we will prescribe universal antidote, unitiol, tiol group containing drug. The next one is acids and alkyls. For example, boric acid, salicylic acid, or benzoic acid. These drugs with antibacterial activity and with conservating activity. Mineral oils, synthetic balms, and sulfur and pitch containing drugs has antibacterial activity, and some plants used in medicine like antibacterial compounds, for example, calendula-based drugs or saphora plant-based drugs. The next title is antibiotics. Antibiotics, it's substances derived from microorganisms. It is biosynthetic antibiotics or produced synthetically. Antibiotics, they are destroy or limit the growth of living organisms. Classification according to source. Natural drugs, it's drugs produced by fungus, bacteria, or actinomyces, for example, penicillins, polymyxins, tetracyclines, aminoglycosides, and other. The synthetic drugs, they are derivatives of natural antibiotics. According to antimicrobial activity, antibiotics subdivide in two groups. It is bactericidal. It means that drug kills the microorganism, and bacteriostatic. It means that drug suppress the growth of microorganisms. According to spectrum of activity, it's drugs with narrow spectrum of activity and broad spectrum of activity. For example, drugs with broad spectrum of activity, it's amphinicols, it's tetracyclines, it is semisynthetic, some semisynthetic penicillins or cephalosporins, but drugs with narrow spectrum of activity, for example, biosynthetic penicillins or or polymyxins and other. According to mechanism of action, there is important 4 mechanisms of action. Antibiotics can interfere to cell wall synthesis. Generally, cell wall consists of peptidoglycan. Drugs which interfere to cell wall synthesis, they are destroy the synthesis of peptidoglycan, and it is beta-lactam, ring-containing antibiotics, penicillins, cephalosporins, carbapenems, and monobactams, and glycopeptide vancomycin. Bacitracin is locally acting drug. Drugs which interfere to membrane permeability, it is polymyxins. Both these two groups, it's polymyxins, drugs which alterate the cell membrane permeability. Both these two groups of drugs, these drugs are bactericidal drugs, and these drugs are kill the microorganisms. Drugs with bacteriostatic effect, they are cross through cell wall membrane and affect on ribosomal protein synthesis. Some drugs like macrolides, clindamycin, alphenicol, streptogramins, they are interact with 50S microbial subunit and prevent the growth of microorganisms. But tetracyclines, aminoglycosides, these drugs bind to 30S ribosomal subunit, and by this way they are prevent the growth of microorganisms and result produce bacteriostatic effect. Rifampicin is interfere to nuclear, cause inhibition of RNA, and therefore prevent the growth of microorganisms, and as a result produce bacteriostatic effect. Generally, for treatment of infection diseases, we began the treatment with a loading dose of antibiotics. It's 1. If antibiotics used a prolonged time, it's important to administration of antifungal drugs, and after antibiotic therapy, it's a recommended administration of vitamins. The big problem of antibacterial therapy, it is resistance development. What's the important mechanisms of resistant development? The first one is modification of cell wall protein. Modification of cell wall protein. In this case, antibiotic, these bubbles, couldn't enter into a microbial cell. Or the second one, it is modification of drug targets. For example, biosynthetics or semisynthetics penicillins, beta-lactam ring-containing penicillins, they are bind to penicillin binding protein. Modification in target of binding cause development of resistance, for example, to penicillins or beta-lactams, or modification of ribosomal targets, for example, on the surface of 50S, 30S, again produce the resistant development. The next one is enzymatic inactivation of drugs. These drugs, this is microbial cell produce its own specific enzymes which destroy the antibiotics. For example, aminoglycosides produce transferases which destroy by 3 ways: acetylation, adenylation, and phosphorylation of antibiotics. Or some bacteria produce beta-lactamases and penicillinases, which can destroy the beta-lactam ring of penicillins, or methylases produced by some bacteria are destroyed the macrolides. And at last, the fourth mechanism of resistant development, it is so-called efflux mechanism. It is activation of antibiotics outflow from microbial cells. And drugs which inhibit the cell wall synthesis. We can divide these drugs into groups. It is beta-lactam ring containing drugs, penicillins, cephalosporins, carbapenems, monobactams, and vancomycin from glycopeptide group. These drugs are bactericidal drugs. These drugs bind to a penicillin binding protein receptor and inhibit the peptidoglycan synthesis. Let's look how act these drugs. Beta-lactams mechanism of action. This one, penicillins, cephalosporins, monobactams, carbapenems. Beta-lactams bind to transpeptidase enzymes active site, and by this way they block the transpeptidase activity, and as a result interrupt the crosslinks, this one, and as a result destroy the cell wall synthesis, because by this way take part degradation of protein glycan synthesis. It is mechanism of action of beta-lactams. But what the important mechanisms of resistant development? The resistant development, the first one, microorganisms, microbial cells, they are synthesized penicillinases, beta-lactamases. It's their own enzymes which are break down the beta-lactam ring of penicillins. The next one is structural change in protein, penicillin binding protein on the surface of microbial membrane. And the third one is change in porin structure. It's concern of gram-negative bacteria. Beta-lactam antibiotics, penicillins, cephalosporins, monobactams, and carbapenems. As we know, this drug has similar chemical structure. All these drugs contain beta-lactam ring. But what the difference between these drugs? Difference in their spectrum of activity. For example, ultra-spectrum acting drugs are carbapenems. Wide-spectrum acting drugs are cephalosporins or aminopenicillins, antipseudomonadal penicillins. Drugs with narrow spectrum of activity, it is biosynthetic penicillins, it is antistaphylococcal penicillins, it is monobactams. Next difference in their ability to cross blood-brain barrier. For example, carbapenems can cross, or aminopenicillins easy penetrate, cephalosporins from third and fifth generation. The next, their ability to interfere with beta-lactamases. Some penicillins are beta-lactamase stable, some of them are beta-lactamase sensitive. For example, penicillins are destroyed by beta-lactamase. Antistaphylococcal penicillin, they are stable, resistant to beta-lactamases. And Monobactams or carbapenems, they are resistant to beta-lactamases and penicillinases. The next title is penicillins. Penicillins, it is widely using antibiotics. It's non-toxic antibiotic, and they are divided in two groups: biosynthetics, it's natural, which are synthesized from fungus, and semi-synthetics, it's their derivatives. Penicillins subdivide into group, as I told, and biosynthetic antibiotics for parenteral use, because they are destroyed in gastric juice environment. It is short-acting benzylpenicillin sodium, benzylpenicillin potassium, long-acting procaine-benzyl penicillin, for example, which will inject it once a day, bicillin 1 once a week, bicillin 5 once a month. Only one biosynthetic penicillin is phenoxymethylpenicillin. It's drug which is gastric juice stable and therefore can be used enteral. Biosynthetic penicillins, drugs with narrow spectrum of activity, they're effective against gram-positive bacteria and some gram-negative bacteria. These drugs does not cross blood-brain barrier. They are eliminated via kidney by secretion way, and they are sensitive to beta-lactamases. It means they are destroyed by beta-lactamases produced by microorganisms. Semi-synthetic penicillins, unlike biosynthetics, is more broad-spectrum acting. Both big part of them are penicillinase resistant, and some drugs can be administered per oral. They are acid stable. For example, the first one is penicillinase resistant antistaphylococcal drugs, oxacillin, nafcillin, cloxacillin, but spectrum of activity is generally gram-positive bacteria. Broad-spectrum acting drugs, ampicillin, amoxicillin, it's aminopenicillins. They are affecting gram-positive, gram-negative bacteria, but they are beta-lactamase susceptible. It means they are destroyed by beta-lactamases and therefore can be used in combination with beta-lactamase inhibitors. Anti-pseudomonadal penicillins, carboxypenicillins, urea penicillins, more broad-spectrum acting drugs, and some of them will be used with beta-lactamases inhibitors like ticarcillin and piperacillin. Therefore, penicillins can be used in combined form. For example, ampiox contain ampicillin, oxacillin. It is synergistic combination. Ampicillin is broad spectrum acting and cross BBB. Oxacillin is narrow spectrum acting but beta-lactamase stable. Ampicillin plus sulbactam. Augmentin, it's amoxicillin plus clavulanic acid. What is clavulanic acid? What is sulbactam and tazobactam? It's inhibitors of beta-lactamases, which are often used in combination with penicillins to prevent their inactivation. Penicillins are non-toxic compounds, and generally their side effect may be allergic reactions, for example, rashes or anaphylactic shock. In some cases, can develop gastrointestinal disturbances, and in some cases, these drugs can affect in some cases on liver, on kidneys. It's non-toxic drugs and it's first choice drugs. The next drugs are cephalosporins. Cephalosporins, beta-lactam ring containing drug. It's antistaphylococcal drugs. Big part of these drugs are beta-lactamase stable drugs, and they are divided into generation according to their ability to cross BBB and according to their spectrum of activity. The first generation is, for example, cefazolin, which affect on gram-positive bacteria, does not cross BBB. The second generation for cefuroxime, cefaclor, cefoxitin increase activity against gram-negative and less against gram-positive, and these drugs does not cross blood-brain barrier. The third generation is ceftriaxone, cefotaxime. They are very good against gram-negative and reasonable against gram-positive. Ceftazidime has anti-pseudomonadal activity. Drugs from third generation easy cross blood-brain barrier. The first generation drugs is cefepime and cefpirom. It's drug with broad spectrum of activity. Cephalosporins are non-toxic drugs, are widely using drugs. It's first choice drugs in the treatment of several infections. The carbapenems and monobactams. The representative of this group, imipenem, meropenem, it's ultra-broad spectrum acting antibiotic. This antibiotic is active against many anaerobics and aerobics, gram-positive and gram-negative bacteria. Imipenem is resistant to all beta-lactamases, and imipenem generally used with cilastatin because imipenem is degraded by dehydropeptidase enzyme which present in kidneys. Therefore, imipenem used in combination with cilastatin. The drug name is Primaxine. Meropenem is cilastatin stable drug. Aztreonam, it is drug with narrow spectrum of activity, and this drug generally effective against gram-negative aerobic bacteria, including Pseudomonas, Neisseria meningitis, and Haemophilus influenza. Aztreonam is administered intravenously and eliminated via tubular secretion. It is side effects in some cases, superinfection, rarely hepatotoxic effect can occur, and generally used in case of penicillinase. It's prescribed to patients with penicillin-resistant patients. So, the next drug is vancomycin. Vancomycin, it is glycopeptide derivative. Vancomycin, how to act this drug? It is bactericidal drug. This drug directly bind to the ala end, this one, of protein glycan, this one, and form the cap over the ending, and therefore block the crosslink. Vancomycin is bactericidal drug which inhibit the protein glycan synthesis. Vancomycin is narrow spectrum acting drug, and generally it's effective against 2 gram-positive bacteria. For example, which can be used for treatment of methicillin-resistant staphylococcus, or vancomycin can be used for treatment of infections caused by Clostridium difficile. Vancomycin is not absorbed from gastrointestinal tract, and may be given orally, for example, for treatment of bacterial enterocolitis. When given parenterally, vancomycin penetrate the tissues and eliminate in unchanged form. It's a toxic compound, and the toxicity associated with phlebitis, ototoxicity, nephrotoxicity. The rapid IV intravenous infusion may cause diffuse flashing syndrome, so-called red man syndrome, and the reason is liberation of histamine. The next groups of drugs are drugs which inhibit the protein synthesis. It is following targets of action of these drugs. Drugs which can bind to 50S subunits of microbial ribosomal site. Drugs which bind to 50S subunits, it's, for example, chloramphenicol or linezolid. The drugs which bind to 50S subunits, it's macrolides, clindamycin, streptogramins, and by this way they are suppress and inhibit the growth of microorganisms. Drugs which bind to 30S subunit of ribosomal microorganism and by this way prevent the protein synthesis, it is tetracyclines and aminoglycosides. And by this way these drugs produce bacteriostatic effect. Important mechanisms of bacterial resistance development at drugs, antibiotics which interfere to protein synthesis. And the first one is impairment of influx and increase of outflow, efflux of microorganisms from body. The next one, it is ribosomal protection. The next one, the second two, it is ribosomal protection associated with synthesis of specific ribosomal proteins. In this case, drug couldn't bind to these subunits and develops resistance. And so-called enzymatic degradation, this one, microorganisms, they are synthesized their own enzymes which are degrade the antibiotics. For example, macrolides produce esterases, methylases, aminoglycosides, they are destroy antibiotics by acetylation, phosphorylation, adenylation reactions. The first one is amphenicol group. The representative is chloramphenicol. Chloramphenicol is a drug with wide spectrum of antimicrobial activity. It's bind to 50S subunit of microbial ribosomal site and prevent the protein synthesis and as a result produce bacteriostatic effect. Chloramphenicol is lipophilic compound. As I told, it's drug with broad spectrum of activity. It's used for treatment of salmonellose, of chlamydios, for treatment of pneumococcal, meningococcal infections. It is lipophilic drug and therefore cross easy through different barriers, including blood-brain barrier, placental barrier. Chloramphenicol undergo enterohepatic cycling and only in small dose, in unchanged form, can excreted with urine. Chloramphenicol affect on liver enzymes and inhibit the microsomal enzymes in liver and therefore increase the toxicity of phenytoin, warfarin, and tolbutamine. The side effects of this drug, as I told, it is reserve drug, is non-basic drug because it's toxic, very toxic drug, and side effects are gastrointestinal problems. It's broad-acting drug, therefore can develop the superinfection, candidiasis. It is hematotoxic drug. It's inhibit the red cell formation. It's produce the hematological problems like agranulocytosis, anemia. In case of deficiency glucose 6-phosphate dehydrogenase enzyme, these drugs can produce erythrocytes hemolysis. Gray baby syndrome. Its syndrome occurs in infants and characterized by decreased red blood cells, cyanosis, and cardiovascular collapse. And the reason of gray baby syndrome, it is insufficiency, it's problems with mitochondrial oxidation reduction processes, and as a result develops a collapse. The next drugs with broad spectrum of activity are tetracyclines. Tetracyclines are bacteriostatic drugs, and their mechanism of action is 30S ribosomal subunit. Tetracyclines inhibit the protein synthesis by blocking the attachment of changed amino acid tRNA to the A site on the ribosome. Tetracyclines bind to 30S ribosomal subunits. These different drugs, which can classify it according to their duration of action. For example, short-acting tetracycline, intermediate-acting demeclocycline, long-acting doxycycline, minocycline. It drugs with wide tissue distribution. These drugs are cross-placental barrier and therefore contraindicated to pregnancy. All tetracyclines undergo enterohepatic circulation. Some tetracyclines are administered peroral, or demeclocycline can be used parenteral, or tigecycline. Tetracyclines can interact with multivalent cations, and therefore they are contraindicated with some multivalent cation containing drugs. For example, with iron containing drugs, with antacids, because they are form the chelate compounds. Tetracyclines, they are used for treatment of chlamydiosis, rickettsiosis, mycoplasma, in some cases used for treatment of protozoa infection. Tetracyclines are broad-spectrum acting drugs, and they are effective against Helicobacter pylori. For example, demeclocycline or doxycycline used in the treatment of malaria or amoebiasis. It is toxic effects of tetracyclines, widely used, drug with wide spectrum of activity, can produce gastrointestinal disturbances like enterocolitis, candidosis, superinfection, bone structure and teeth problems. For example, tetracycline accumulate in tooth emal, so-called tooth tetracycline teeths, or regulates the bone growth, and as a result, hematological problems develops. Tetracyclines are anti-anabolic antibiotics. It's hepatotoxic drugs because they are accumulate in liver, renal toxicity, photosensitivity, and vestibular toxicity. It is characteristics of tetracyclines. The antibiotics from macrolide group, it is erythromycin, roxithromycin, azalide, it is azithromycin. These drugs with narrow spectrum of activity, macrolides, effective against gram-positive bacteria. There does not cross through blood-brain barrier. The mechanism of action associated with binding to macro 50A subunits, it's bacteriostatic drugs. Generally, they does not cross blood-brain barrier, but penetrate the placental barrier. It's non-toxic drugs, but it's reserved drugs. Why? Because resistance develops very fast, and the mechanisms of resistant development, it is at first the synthesis of methylase enzyme, which cause destruction of macrolides, and destruction or synthesis of microbial proteins on the surface of 50S subunits, and again inhibition, decreasing in efficacy of antimicrobial therapy. Widely using drugs for treatment of respiratory tract infection, pharyngitis, tonsillitis, is drug for treatment of chlamydiosis, gonorrhea, and in case of infection of lower respiratory tract infection, pneumonia, anthrax, and some of these drugs, for example, clarithromycin, can be used for treatment of gastric ulcer. Macrolides are bacteriostatic drugs, and as I told, it's non-toxic drugs, and adverse effects: nausea, vomiting, diarrhea. Diarrhea is associated with activation of motilin receptors, and activation of motilin receptors produce prokinetic effect. In some cases can develop abdominal pains, liver toxicity in some cases, and macrolides, exception azithromycin, is inhibit the microsomal enzymes, and therefore can increase the toxicity of some related drugs. As I told, development of resistance very fast, exception joyzilicin. The next group of drugs, it is lincosamides, lincomycin, and clindamycin. These drugs are inhibit the bacterial protein synthesis by mechanism similar to macrolides. Also, these drugs are not chemically related. Mechanism of resistance include the methylation of the binding site of the 50S ribosomal subunit and enzymatic inactivation. As I told, the spectrum of action is like to macrolides, but the resistance develops rarely and late than to macrolides. The spectrum of activities, as I told you, it is gram-positive anaerobic bacteria, These drugs penetrate most tissues, including abscesses. These drugs are administered orally and IV. Intramuscular, it's non-recommended because it's irritate and can produce necrosis. Does not penetrate blood-brain barrier and therefore does not cross the CNS. What's the files of administration? Clindamycin can be administered generally for the treatment of oral infections or lung abscesses and aspiration pneumonia. Lincomycin, it's a first choice drug for the treatment of osteomyelitis because it's affect on gram-positive and does not affect on aerobic bacteria. The important side effects are nausea, vomiting, diarrhea, and generally and widely occurring adverse effect, it is pseudomembranous colitis, which will be treated with metronidazole or vancomycin. And at last, the aminoglycosides. It is antibiotics with not so broad spectrum of activity, but these drugs are interfere to protein synthesis on ribosomal level and kill the microorganisms. Aminoglycosides are bactericidal drugs. Aminoglycosides, it is streptomycin, clindamycin, gentamicin, sizomycin, kanamycin, amikacin. Aminoglycosides, it's hydrophilic polar drugs, and their influx into cell is oxygen dependent entering. Therefore, these drugs are not affect on anaerobes. Aminoglycosides are hydrophilic polar drugs, and therefore these drugs administered IV, intravenous, or intramuscular or topical. Only neomycin use oral before surgical operation on the bowels, and this drug cause sterilization of bowels. It's not absorbed from gastrointestinal tract because this drug is hydrophilic and polar. Neomycin has hypolipidemic activity. Aminoglycosides does not cross blood-brain barrier, and big part of these drugs are eliminated in and changed form with urine. These drugs used for treatment of pneumonia, endocarditis, for treatment of sepsis, in the skin infection, and generally aminoglycosides used in combination with cell wall inhibitors, with penicillins, because penicillins destroy the cell wall and therefore facilitate the cross-link of aminoglycosides. About side effects of aminoglycosides, adverse effects of aminoglycosides. It is ototoxicity, in some cases irreversible. Therefore, these drugs are contraindicated in childs, and ototoxicity is increased in case of in combination with ototoxic drugs, for example, with ototoxic diuretics. Nephrotoxicity, because these drugs eliminate with urine, And the third adverse effect, it is curare-like effect. Therefore, these drugs are contraindicated to patients with myasthenia. It was antiseptic disinfectants and antibiotics. Thank you for your attention.